CTI Life Health is a digital healthcare platform that leverages a lot of technology and artificial intelligence in order to be able to provide medical care to people that very often wouldn't be able to have access to medical care. The visual that you have in front of you is what a typical wallet of an individual patient would look like. And the discussion that I would like to have an overview of over here is from the perspective of the ethical decisions that are going to be, that we need to be making along the way in terms of what information do you give the patients access to. If we have information about them that they're not familiar with, can we tell it to them? Do we need their permission? Do we want to scare them with some genomic data about their proclivity to be able to get a certain disease in the future? How much access do we allow third parties to have on people's data? The way we've designed our system is that people actually have control of their own medical data. As you see from the top, they actually can reject or accept a doctor's request, and people control their own data. As a quick high level, you'll be able to see information over here that we collect. So for example, blood type, we've got a visual on a blood type, we collect some drops of blood, the health worker puts it in information in, and then we can now determine they're A positive blood. The patient's got a full record of all of their vaccination information, and now we're able to go and see when they were vaccinated by and who. And in the event that there's a problem with a particular vaccine, we can go back and check the serial number and then go back to all the other patients. So as we go and review all of these different elements, there's always going to be ethical questions in terms of what information we pass on, what information we're allowed to do research on. Over here, we're able to go and collect patients' medical history from the patients, and then the doctors will be able to then verify the information. On the vital signs, we're able to go and collect the vitals. We're able to see a complete history of the vitals of the particular patient, whether it's the blood pressure, the glucose levels, the pulse and oxygen readings, etc. And with this information, we can now be using that, and we are using that for diagnostic purposes. So we also do the same thing with the lab results. We collect a whole variety of blood results from the laboratory, for example, the CBC readings. We include the information in a digital format, so the system knows instantly if you're green, it's normal, if it's red, it's high, if it's low, it's in blue. And if the patient is worried about their numbers, they can click on the 4W, which are the 4 Ws of healthcare. What does BASO mean? Why should I take my BASO? Where does it fit in the range? When my BASO is out of the range, what do I do? Now, also included in this platform is a lot of additional data as far as, kind of a history of doctor visits. You'll be able to see, kind of the last time they came in with a particular problem, and you have, in this case, an eye issue, you'll be able to go and see the attachment and see a picture of the eye. And then we'll be able to run artificial intelligence in the future where we're doing analysis on all of this. The prescriptions, we'll be able to see every time a person got a prescription, and then the artificial intelligence is going to then be analyzing the data to see, was the diagnosis good? Was the prescription good? Was it? And then we're able to, the artificial intelligence will then start educating us in terms of what works and doesn't work in the right environments. Here is where it starts to get very personalized. So here with the health status, now based on the person's bio, their vitals, and their blood results, we are able to now tell the patients that they are stage 2 hypertension, or they've got normal blood sugar, they're at risk of heart disease. The challenges that will happen over here become when we have information and the patient has never seen a doctor, and now do we tell them that they are stage 2 hypertension? Do we not tell them? Now, we don't necessarily have the funding available at all times to be able to go and support these people. So from an ethical perspective, what's the way to do this? Do we ask the people to sign a waiver in advance to say, yes, we're going to be collecting your information and giving it to you, and you accept the fact that we're going to give you information that you may not be happy about, but that this is where the ethical discussions come in. And then the artificial intelligence will come in on top of this to be able to tell a patient based on their history, and we're going to be including genomics in all of this, that you've got a proclivity to be able to get a certain disease. Now, the artificial intelligence isn't always 100% correct. Sometimes the machines make mistakes. So what is the ethical boundaries of what do we say, what do we not say? Now, when it comes to the actual, I'm going to give you now kind of a little example. I'm going to now stop sharing kind of this screen and share a different screen where we can start doing some more specific analytics on the data. So this is a visualization of the data. This is an Excel spreadsheet. Normally it would be in a core database, but in order to be able to visualize it, so you can see, the age of the person, male, female, you've got the location of where they live. Do they have mental health problems, sickle cell carrier? Yes or no? Do they have a disability? If they agree to be blood donors, what's their blood pressure? And now we run algorithms to be able to determine, is it normal or is it hypertensive crisis? And then we go through all the different elements of the person, diabetes, HbA1c, are they high, low? And for most people in the developing world, they've never had an examination like this. Blood group, most people don't know their blood group. So we're collecting a huge amount of data that can now be analyzed to be able to provide people with a very, very solid view of what their current health status is, which is a beautiful thing. But are the people ready? Because they may not be able to get the drugs. We can provide them, we can educate them, and that's part of what our system is all about. But there are obviously a lot of discussions around the ethics. Here we're just, again, going through all the different bloods, hepatitis B, hepatitis C, positive, negative, and then we go all the way to the end, vaccinations. What were you vaccinated for? What weren't you vaccinated for? So what we've done over here is to now create a visualization of that data. So for example, if you want to go ahead and do a trial, a medical data clinical trial, and we want to do a clinical trial on people who've got diabetes. So you identify the area at the bottom here, people who've got diabetes, it's high, so glucose is high, so these people who've got diabetes, you've got 115 people. Now we want to go and identify, let's say we have a very unique drug that is for people who are positive HIV, and they've got diabetes. So we click on the positive HIV, but then we need to identify people who've agreed to be part of a clinical trial. So now you click on yes. So now we're able to go and break it down and keep breaking it down. And then we want to be able to go and create an age group. We only want people from age, say from age 20 to 70, or in this case, 22 to 70. So you got the 12 people. So now we can go and invite these people. But there may be certain specific situations where we can identify very unique people and problems that these people may have, and yet they haven't agreed to be part of a clinical trial. Are we allowed to reach out to these people? Not allowed to reach out to these people. And there's another example will be, let's say we have a young woman and she's having a baby, and God forbid she's bleeding and she needs blood immediately. So first we had to have time to go and bring the blood from the capital city because she needs the blood right now. So let's first identify the parish. So she's in the parish of Lagoba. So now within Lagoba, we identify Lagoba, and now there are 280 people within this area of Lagoba. Now, we obviously can't give blood from somebody who's positive HIV, so we go for the negative HIV. We don't want to give blood from somebody who's got malaria, so it's got to be negative on malaria. You don't want to give blood from somebody who has got hepatitis A or hepatitis B. So we have to remove hepatitis A and hepatitis B. And now we start looking at, okay, have they given permission to go and give their blood? So we've got 120 people who've given permission. But now if the person is very unique and they've only got O negative blood, so you're down to 3 people. And well, we don't want to give some blood from somebody who's 80 years old. So we have to now, can restrict it to, let's say, 65 years old. All right. And then within the 65 years old, you're now down to 2 people. So, and then within these 2 people, they've got 2 of them, they've both got diabetes. So do we now go to, do we say, well, let's go and reach out to the 3rd person who's not given permission or not. So these are some of the tools that are going to be used within the artificial intelligence world, within the technology world, and guidance from, kind of our religious leaders is going to be very important in terms of how we make practical decisions based on practical solutions, such as the CTI Life Health platform, in terms of what do we inform people? Do we ask them for permission in advance to inform them? Do we make them aware that there'll be decisions that the computers that will make may be wrong occasionally? So thank you very much for listening.